CEN Exam Prep Exam. Question 1. A patient presents with cough minus ground emesis and melena. What is the priority nursing action? Option A. Administer 4 fluids. Option B. Insert a nasogastric tube. Option C. Prepare for blood transfusion. Option D. Assess airway and breathing. The correct answer is option D. Assess airway and breathing. The ABCs take priority. Cough minus ground emesis and melena indicate an upper GI bleed. The patient is at risk for aspiration and hypovolemic shock. Airway assessment and breathing are the first steps. 4 fluids, A, blood transfusion, C, and ing tube insertion, B, are important but secondary to airway assessment. Question 2. A patient presents with nuchal rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A. CT scan of the head. Option B. Lumbar puncture. Option C. MRI of the brain. Option D. Blood cultures. The correct answer is option A. CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test. Question 3. A patient who has ingested a large amount of acetaminophen is at risk for? Option A. Acute kidney injury. Option B. Hepatic necrosis. Option C. Pulmonary fibrosis. Option D. Cardiomyopathy. The correct answer is option B. Hepatic necrosis. Acetaminophen toxicity causes hepatic necrosis due to accumulation of the toxic metabolite NAPCI, which depletes glutathione and damages hepatocytes. Acute kidney injury, A, can also occur but is secondary. Pulmonary fibrosis, C, and cardiomyopathy, D, are not associated with acetaminophen toxicity. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient is experiencing a tension pneumothorax following chest trauma. The nurse anticipates which intervention? Option A. Needle decompression at the second intercostal space, midclavicular line. Option B. Needle decompression at the fifth intercostal space, anterior axillary line. Option C. Chest tube insertion at the second intercostal space, midclavicular line. Option D. Supplemental oxygen and observation. The correct answer is option A. Needle decompression at the second intercostal space, midclavicular line. Tension pneumothorax is a life-threatening condition requiring immediate needle decompression. The needle should be inserted at the second intercostal space in the midclavicular line on the affected side. This releases trapped air and relieves pressure on the heart and great vessels. The fifth intercostal space, B, is for chest tube insertion. Chest tube insertion, C, is the definitive treatment after needle decompression. Question 5. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A. Administer 4 lorazepam. Option B. Assess for head injury. Option C. Obtain a stat CT scan. Option D. Perform a detailed neurological assessment. The correct answer is option A. Administer 4 lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Question 6. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is? Option A. Tracheal intubation. Option B. 4 fluids. Option C. Needle cricothyrotomy. Option D. Pleural decompression. The correct answer is option C. Needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. For fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 7. A patient presents with alcohol intoxication. Which assessment finding is most concerning? Option A, slurred speech. Option B, gait instability. Option C, nystagmus. Option D, decreased level of consciousness. The correct answer is option D, decreased level of consciousness. Decreased level of consciousness is the most concerning finding in alcohol intoxication, as it may indicate severe intoxication, hypoglycemia, head trauma, or other co-ingestions. Slurred speech, A, gait instability, B, and nystagmus, C, are expected signs of intoxication. Question 8. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A, abdominal guarding. Option B, rebound tenderness. Option C, rigid, board-like abdomen. Option D, a flatulence. The correct answer is option C, rigid, board-like abdomen. A rigid, board-like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than board-like rigidity. Flatulence, D, is not concerning. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. Which nursing intervention is most important for a patient with an ING tube to low intermittent suction? Option A, change the ING tube every 24 hours. Option B, provide frequent mouth care. Option C, maintain the patient in a supine position. Option D, flush the tube every 8 hours with 50 ml of sterile water. The correct answer is option B, provide frequent mouth care. ING tube to suction can cause a dry mouth and sore throat. Frequent mouth care, including oral hygiene and moisturizing lips, is essential. The tube does not need to be changed daily. A, supine position. C, increases risk of aspiration. Flushing, D, depends on hospital policy and should not use large volumes. Question 10. A patient with acute ischemic stroke arrives at the ED 2 hours after symptom onset. Which question is most important for determining eligibility for thrombolytic therapy? Option A, what is the patient's blood pressure? Option B, what time were the patient's symptoms last known to be normal? Option C, does the patient have a history of hypertension? Option D, what is the patient's family history? The correct answer is option B. What time were the patient's symptoms last known to be normal? The time of last known normal is the most critical factor for determining eligibility for thrombolytic therapy with TPA. The window is up to 4.5 hours for select patients. Blood pressure, A, is also important, but the time window is the primary determinant. History of hypertension, C, is relevant but not as critical. Question 11. A patient presents with signs of sepsis. Which of the following is the most important early intervention? Option A, administer broad-spectrum antibiotics. Option B, administer 4 fluids. Option C, obtain blood cultures. Option D, start a vasopressor. The correct answer is option C, obtain blood cultures. In sepsis, blood cultures should be obtained before starting antibiotics to identify the causative organism. Antibiotics, A, should be given as soon as possible but after cultures. For fluids, B, are given simultaneously with cultures. Vasopressors, D, are started after fluid resuscitation. Question 12. The possibility of an ectopic pregnancy increases when a patient has a history of Option A, breast cancer. Option B, endometriosis. Option C, teenage pregnancy. Option D, pelvic inflammatory disease. The correct answer is option D, pelvic inflammatory disease. Pelvic inflammatory disease, PID, can cause scarring and damage to the fallopian tubes, increasing the risk of ectopic pregnancy. Endometriosis, B, can increase risk, but PID is the most significant risk factor of these options. Breast cancer, A, and teenage pregnancy, C, are not risk factors. Question 13. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A, apply heat for the first 24 hours. Option B, apply ice for the first 24-48 hours. Option C, begin range of motion exercises immediately. Option D, avoid immobilization to prevent stiffness. The correct answer is option B, apply ice for the first 24-48 hours. For acute sprains, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24-48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing. Question 14. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A, explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B, tell the patient they must undergo the exam to report the assault. Option C, perform the exam yourself to minimize the number of people involved. Option D, delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice. Question 15. A patient presents with signs of hypothermia. Which core temperature indicates severe hypothermia? Option A, 32 degrees Celsius. Option B, 30 degrees Celsius. Option C, 28 degrees Celsius. Option D, 26 degrees Celsius. The correct answer is option C, 28 degrees Celsius. Severe hypothermia is defined as a core temperature below 28 degrees Celsius (82.4 degrees Fahrenheit). At this temperature, the patient may be unconscious with minimal or absent vital signs. Mild hypothermia, 32-35 degrees Celsius, A, moderate, 28-32 degrees Celsius, B, and severe, 28 degrees Celsius, C. Option D, 26 degrees Celsius, is also severe, but 28 degrees Celsius is the threshold. Question 16. A patient presents with tachycardia, palpitations, and weight loss. What endocrine disorder is most likely? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, diabetes mellitus. Option D, Cushing's syndrome. The correct answer is option A, hyperthyroidism. Hyperthyroidism presents with tachycardia, palpitations, weight loss, anxiety, and heat intolerance. Hypothyroidism, B, presents with bradycardia, weight gain, and cold intolerance. Diabetes, C, presents with polyuria, polydipsia, and polyphagia. Cushing's syndrome, D, presents with weight gain, moon phases, and hypertension. Question 17. A patient with severe asthma exacerbation has a peak expiratory flow rate, PEFR, of 35% of personal best. Which treatment should the nurse anticipate? Option A, continuous nebulized albuterol. Option B, oral corticosteroids. Option C, 4-magnesium sulfate. Option D, immediate intubation. The correct answer is option A, continuous nebulized albuterol. PEFR below 50% indicates a severe exacerbation requiring aggressive bronchodilation. Continuous nebulized albuterol is indicated for severe asthma. Oral corticosteroids, B, should also be given but are not the immediate treatment. 4-magnesium, C, may be used for refractory cases. Intubation, D, is for impending respiratory failure with altered mental status, exhaustion, or hypercapnia. Question 18. A patient with cirrhosis presents with hematemesis. What is the most likely source of bleeding? Option A, peptic ulcer. Option B, esophageal varices. Option C, gastritis. Option D, a Mallory-Weiss-Tear. The correct answer is option B, esophageal varices. Patients with cirrhosis develop portal hypertension, leading to esophageal varices. These are fragile and prone to bleeding, causing hematemesis. While peptic ulcers, A, gastritis, C, and Mallory-Weiss-Tears, D, can also cause upper GI bleeding, esophageal varices are the most likely source in a patient with cirrhosis. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which of the following is a priority intervention for a patient with priapism? Option A, administer pain medication. Option B, apply ice to the genital area. Option C, prepare for surgical intervention. Option D, administer oxygen. The correct answer is option C, prepare for surgical intervention. Priapism is a prolonged erection lasting more than 4 hours, which can lead to ischemic injury and permanent erectile dysfunction if not treated promptly. The priority is to prepare for interventions such as aspiration, irrigation, or injection of sympathomimetic agents. Pain management, A, and ice, B, may be used but are not the priority. Oxygen, D, is not the primary intervention. Question 20. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A, apply fresh water to the area. Option B, apply vinegar to inactivate nematocysts. Option C, apply heat to the area. Option D, rinse with seawater and apply ice. The correct answer is option B, apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 21. The nurse is caring for a patient who has been diagnosed with an advanced end-stage cancer. The medical team has suggested palliative care and hospice. Which of the following statements would be appropriate for the nurse to make when explaining the suggestion to the patient's family? Option A, palliative care begins with the initial diagnosis and continues through the end of life. Option B, the patient cannot change their end-of-life decisions once enrolled in hospice. Option C, there is an important legal distinction between withholding care and withdrawing care. Option D, a living will names a person to make medical decisions if the patient is unable to do so. The correct answer is option A. Palliative care begins with the initial diagnosis and continues through the end of life. Palliative care is appropriate at any stage of a serious illness, starting at diagnosis, and can be provided alongside curative treatment. It is not limited to end of life. Hospice is one type of palliative care for end of life. Patients can leave hospice at any time. B. Withholding and withdrawing care, C, are not what is being explained. A living will, D, is a legal document specifying treatment wishes, while a healthcare proxy names a decision-maker. Question 22. A patient presents with a severe allergic reaction with difficulty breathing and hypotension. What is the priority medication? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Anaphylaxis is a life-threatening emergency requiring immediate epinephrine. Epinephrine is the first-line treatment for anaphylaxis with respiratory or cardiovascular compromise. Diphenhydramine, A, albuterol, C, and hydrocortisone, D, are all used but are secondary to epinephrine. Question 23. A patient with acute pancreatitis has the following labs. Which finding is most concerning? Option A, elevated serum amylase. Option B, elevated serum lipase. Option C, elevated blood glucose. Option D, decreased serum calcium. The correct answer is option D, decreased serum calcium. Hypocalcemia in acute pancreatitis is a poor prognostic sign. It occurs due to saponification of calcium with fatty acids in necrotic fat tissue. Hypocalcemia can also indicate severe pancreatitis with significant necrosis. While elevated amylase A and lipase B are diagnostic, they do not indicate severity. Elevated glucose C is common but less concerning than hypocalcemia. Question 24. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A, administer lithium immediately. Option B, ensure the patient is in a safe, calm environment. Option C, restrict fluid intake to prevent water intoxication. Option D, place the patient in seclusion. The correct answer is option B. Ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium A may be prescribed but administration is a provider order. Fluid intake C should be monitored but lithium requires adequate fluid intake. Seclusion D is only for imminent danger. Question 25. A patient presents with a patellar dislocation. The nurse should monitor for associated injury to the Option A, femoral artery. Option B, sciatic nerve. Option C, popliteal artery. Option D, tibial nerve. The correct answer is option C, popliteal artery. Patellar dislocation can cause injury to the popliteal artery, which lies behind the knee joint. The nurse should assess distal pulses and capillary refill. Femoral artery A is more proximal. Sciatic nerve B is more posterior. Tibial nerve D is also in the popliteal area, but the popliteal artery is the most critical vascular structure.